Oh, did you unmute me? Hello, everyone. So, good evening. Hope everyone has had a wonderful day and is having a good evening. So, I was gonna do this live today and talk about the 4D, but I'm gonna give people some time to get in so you guys can ask questions. But this is one of my favorite treatments because as we age, we notice skin changes, and this will keep your skin healthy and revitalized. And so it's an awesome treatment to have, and we're going to go through what that means and what that looks like. And then if you guys have any questions, of course, along the way, please ask them. And then also drop some comments if there's anything that you want to hear about, because we can do future lives based on that. So I have some slides we'll go through. I did realize that the video that I have attached to the slides isn't quite playing, but we do fortunately have a full video up on Facebook on YouTube. There's a full video of the procedure done. There's some on our webpage, so we'll have some links in there, and you can always also drop an email if you want us just to send you those links. We can do that as well. So we'll get into it. So discover, because I know time is important, especially in the evening when you guys have things going on with family. So we're going to just talk about all the benefits of the Fotona4D. So Fotona is a special laser that we have. We call it the Beast laser. We have lots of different lasers, 16 in our office. So we love lasers and all the things it can do for skin as we get older, and even for sexual function. But with this one, it's the Beast laser. We can do all kinds of different things, and we can actually manipulate the laser to reach different depths in different tissues. And so we can regenerate lots of different areas. We can use this for sexual wellness, to grow hair, to remove hair. But one of the top treatments with this machine is the Fotona4D. So it's a 4D non-surgical laser facelift in the office, no pain, no downtime, with amazing results. And so if you're looking for surgery, it's definitely not surgery. But if you're looking to keep your skin looking healthy, thick, and vibrant, this is a way to do it. And so what it is 4 different laser treatments in one. It's a 4-dimensional. So we'll talk about what those 4 different laser treatments in one treatment is. And by one treatment, I mean you're in the office for an appointment and for an hour, maybe a little bit more, but we're doing a 4D with the 4 laser treatments in that 1 hour. And then it's always done in a series at first to get your skin and the thickness back where we want it. But it's ideal for men and for women, and any time of year. It doesn't have to be in the winter or the fall. We do have a final step that's resurfacing, but we can do that based on your skin needs. And we don't have to do it very intensely during those warmer summer months, especially if you're outside a lot. So with this treatment, again, it's no downtime if you have that conversation with the laser specialist that's performing the procedure. So it doesn't have any needles. So it's just the laser. It's minimal discomfort. And if we're doing anything that's uncomfortable, it's that last step when we get to resurfacing. But if we do it mild, then we don't have to have downtime and there's just a little redness. But if we want more in the way of resurfacing and effects, then you may have a couple days of redness, but really little to no downtime and what I call social downtime. So it is an in-office procedure, usually done in a series at first, but you'll get immediate benefits and then you get long-term benefits. And again, it's 4 laser treatments in the one treatment in the office. It's safe for all skin types. You can do it all year round, and it targets many different concerns. So if you have fine lines and wrinkles, you have a pore sizes that are too big and bothersome, or pigment, you can treat it with any of this, but it's going to thicken all of the skin. So it's like the mattress versus the sheet. The mattress needs to be thick and healthy. So basically, what we're doing is the first step. And so they have different names. And basically, this laser, it is the beast because it has 2 different wavelengths. But that means that it has an erbium treatment wavelength and it has an ND-YAG treatment, which is a 1064. So that's science related. But what we're saying is we go to an erbium for different effects, and then we go a little bit deeper with the ND-YAG, and then we come back out for a resurfacing. So the first laser treatment, the first part of the treatment is an intraoral. So I'm going to go back a slide first. So when we're going in the mouth with this laser, and the reason that we do it, and that's the first step, is because you can't get to the deep dermis any other way. So if we wanted to get to the deep dermis, we end up going with, say, an all therapy or an Althera machine. And if anyone is familiar with that, basically it's very painful. You do get to the deep dermis, you get nothing initially, and you can get some improvement ultimately, but you have to wait for that. And so in this day and age, nobody is looking for something that has no immediate benefit. They want to walk out of the office, and ideally we want something magical that happens, in the office. It's magical, it's overnight, and that's not realistic either. But we don't want something so painful and we have to wait 3 or 4 months to see it. This, we can get to the deep dermis just by going in the mouth and doing the intraoral step. So we are basically thickening up the deep dermis. Then we come to the outside and we do a mid dermis on the second step, which is this. So this is the outside. It is a specific wavelength with this laser. And then we go to the upper dermis with a third step. And then we do the resurfacing. So this final resurfacing step is awesome because this is the one where you're going to get pigment, fine lines, tone, texture, all of that. But we've already now heated the deeper tissues. So we've been in the mouth and we've done that deep dermis, we've done the mid, we've done the upper dermis, and now we're doing the epidermal resurfacing. So that's the 4 steps. And ultimately, we can get more intense around the eyes. And so those eye treatments, that's the thinnest skin in the body. And so if we want to get improvement, and if you look at just this picture in the temples and around the eyes, it's going to tighten, it's going to open up the eyes, and that's the thinnest skin in the body. And so it's hard to get that with lasers, but this is one of those you can get the laser tightening, and it's about the only way that you can get certain effects with the eyes. So for instance, we can go over the eyelid with this. It's a more specific and aggressive. And so again, one of the questions is there a more aggressive version? And there absolutely is. So there's a pretty standard 4D, which with amazing results, but you can also customize it a little more, get a little more aggressive or a lot more aggressive in the mouth. And you can actually see the nasolabial folds plump. You can see that perioral around the mouth because those lines are always, not always, but can be very deep with women and bothersome as we get older. And why is it that we get those changes? They don't have to be smokers to get those changes. It's just we lose that support in our lower face. We lose the support in the upper face. So the bone in the fatty tissue, the fat pads, are receding throughout the face. And you'll see those skull and facial bone changes as we age. But then the fat pads in the face actually get smaller with lack of support in the upper face. And then you get a heaviness and more thickened and heavy fat pads in the lower face. But that bony resorption that we have less bony support around the mouth. And that's why you kind of get that sagging around the mouth as we get older. So with this, we can go into the mouth and we're plumping out the deep dermis, but then we come to the outside and we're also thickening that complete skin layer. So this is, again, around the eyes. We can get very intense with this in the mouth. This can completely be customized to a patient. So we can do a little more in the mouth, we can go around the eyes, and that can be more customized for the results we're looking for. We always recommend it at least in a series of 3. And that's until we get effects. So again, at a certain decade of life, we might say that you want to do 4 or 5 of them, depending on your age and when you're starting and what kind of results we want. The nice thing about this is you can also pair it with some injections. So you can do PRP injections, PRP radius, PRF radius, all kinds of different things that stimulate collagen elastin in addition to the laser. My big thing is that as we get older, we lose 1% of collagen a year. And so what we want to do is to make sure that we're stimulating collagen elastin. So say we're 50 or 60 and we have never done any collagen elastin stimulation with lasers. Well, we're already 50 or 60% down. And so you have to constantly on a regular basis be doing something that's stimulating collagen elastin, because that is what we're seeing. We're looking in the mirror and we're seeing changes. And what are those changes? Those changes are actually collagen elastin loss in the skin. Then you get some fat pad changes, which again is decreased fat in the upper face and an increase in heaviness in the lower face, bony resorption, all of that. And you'll have some volume loss as well. So those are things that combine. So you can do some filler for volume loss. You can also do, other laser treatments that are continuing to stimulate collagen elastin in addition to this more intense laser or the 4D. So let me add to this. Let me see. Having some issues with my slides. All right, so basically, here's some before and after pictures. And so if you look at some of these, and these are things that I like to look at and just answer questions and see what the changes are. So if you look at the upper left, you can see lots of deep lines. And what we're doing is plumping that skin and thickening it. And so collagen elastin loss, support loss, you can always combine this with a little bit of PRF radius or just some filler to support volume loss as well. And again, an overall thickening, and yes, the lighting isn't perfect with some before and afters, but just the texture changes, the brightening, the glow of the skin after, the thickening, and just how different it looks in a before and after. Nasolabial folds, jowling. It is appropriate for men. And again, men need beautified as well. And so if the nasolabial folds are an issue or they want some volume support and some tightening, they actually respond very well. And the younger we are when we start doing any kind of laser treatments for regeneration, the better, because the younger you are, the less collagen you have to stimulate. And then you're actually already doing something to stimulate before you're way behind the 8 ball and having loss that is a significant change from what you're seeing in the mirror too. So if you wait until you're 50 to start, and you're now these days with social media, they're actually starting their regeneration treatments much, much earlier. So they'll start those in the 30s and do microneedling and simple laser treatments. And again, that continuous collagen elastin, but doesn't mean we can't start at any age. So each session that you do is about 60 minutes. It can be longer. And again, it can be customized more to results that we're looking to find. So if you have more severe volume loss or collagen elastin loss, then you are absolutely going to need a more customized treatment or more treatments in the series. And so you don't require any kind of sedation, no laughing gas, but if we're going a little more intense with that last treatment step, then we are going to put some numbing on so that we can actually have some topical numbing prior to the resurfacing. And we're usually doing this in a series of 3, and we're doing it 3 to 4 weeks apart. Those are for optimal results anyhow. And again, anybody doing, actually, it doesn't even matter if you're doing laser treatments yet. You need to be considering skincare and medical grade skincare. We have lots of different medical grade skincare lines in the office, but you definitely need to invest in medical grade skincare at any age. You will end up going to Ulta, you go to Sephora, and you're going to spend as much money, and it's a rabbit hole. It depends on the salesperson you get, which product they're recommending, which product they're familiar with. But ultimately, you want to do medical grade where the product is tested. There's studies that they have to test what's in the product, and it works. And you need much less of it. So as you start to have your skin get healthier, then you also are just using less product because your skin's healthier. You're not feeling dry. I recently had a patient say, I was just caking on skincare from Ulta because I always felt dry. And then once I switched to a medical grade skincare product, and this product in particular was a ZO product line, then she wasn't using nearly as much, and her face always felt hydrated. And so it makes a huge difference, and you're already spending it. And women will spend a significant portion of money at Ulta and Sephora, and you need to really do the medical grade skincare that actually has proven results. But also sunscreen. So use that on a daily basis. We never want to have too much in the way of sun exposure. And so this is one of our favorite treatments at Revitalize. And this is what I consider for women or men over 40 and definitely over 50, or anyone that wants some tightening and lifting. So if we're looking in the mirror and we're thinking we want, our skin a little tighter, then you need a more intense laser treatment in addition to anything else that you get. So if you're looking for surgery, obviously, this isn't a surgical procedure, but there is no in-office laser treatment with no pain, no downtime, with magical overnight results. It hasn't existed since 1960s when lasers came to market, and it's not going to magically appear on the market. So you're not going to get a magical overnight, no pain, no downtime with a laser, that surgery. So to be realistic, though, you can get amazing results. And I don't think, the old, thought of having a facelift at the age of 50 is no longer the case, especially if you use or if you take good care of your skin. And so if you're doing lasers on a regular basis, and it's never too late to start that, you will see improvement, but you just need to commit to improvement over time. It's just not magical and overnight. And some things can be. And we'll get to some questions because there are other areas that we do this treatment in. And you do see a more significant acute change. But this is one of our favorite treatments. So if somebody comes to us and they want any kind of lifting and tightening, we're going with the 4D as our primary choice of treatment for them. We can use other things if we potentially want to debulk some area and kill some fat in the face, but that is a specific patient type, but not the usual, because we usually don't want to kill fat in the face. But if we want to tighten up and kind of debulk at the same time, there may be something else that we recommend in addition to. But this is our go-to for lifting. And I always say it's a firm, fill, and finish. So the firming, if you want lifting, then we want this more intense laser treatment. And the 4D is it 4 laser sessions in one, in about an hour, no pain, no downtime, and minimal pain. Again, if we're going to get a little more resurfacing and we're going to go a little more intense on that epidermis and resurfacing, you may have some redness or a couple of days of downtime, but those are discussions you can have. And I still consider that social downtime. 10 years ago, no one would actually have treatments if they thought anyone would ever know. And so now you can get redness, you can peel, and you can tell people you'll look better next week. And it's acceptable. It's just a social downtime now because we're not afraid to talk about Botox when we get it, or filler when we get it, or laser treatments. And it's become an acceptable beautifying process for both men and for women. And this is a state-of-the-art machine. This machine is again, one of the many machines that we use. We call it the beast just because it does so many different areas. So the 4D is a go-to. We have what we call the 4V, which is a non-surgical facelift for the vagina. And it's really just the 4D on the vagina, but we term it the 4V because it can do the same thing, tighten it. It is really like a facelift for the vagina. So, yes, you can do it other places, which is one of the questions. And that specifically, that treatment area does respond a little faster and more intense. So that can be not even just an overnight, but an in-office hour transformation in the external area, the vulva. And so it looks like a vaginal facelift when we're done with it. And the before and afters are amazing. So that is one of the areas. And the reason I think it responds better is it's not internal or a vaginal canal or mucosa, but it's a transition zone. So not as thick as our skin on our face or on our arms. So can you do it on other body parts? You can do all kinds of body parts with this machine. So we can do a tight sculpting, what we call tight sculpting or body contouring. So basically you're talking about killing fat, smoothing out cellulite, tightening skin. And this machine is special because you can also do not just the killing fat or tightening skin, but you can also just tighten skin. And that you can't do with any other body contouring machine on the market. So if you just wanted skin above the knees, for instance, and somebody is skinny, but they have a little bit of loose skin over their knees, this is one that you can actually just target the skin and tightening the skin, but you don't have to kill fat in an area, but you can kill fat if you want to. And so that is a definite, other area that you can do. We can do lips. We have a lip lace. And so again, we have videos of all of this. And definitely if you want to drop emails, we can send them. But otherwise, we're going to also put links for the YouTube site, the 4D, and it's a video that shows that entire process. I thought I could maybe show it on here, but those slides, the videos aren't playing. So we'll do the link for the full video of the procedure. The website does show lots of before and afters, and also that video is on the website. The lip lace is another one. So if we want to customize by doing an eye treatment that's a little more intense, we can do that around the eye, which is called either a smooth eye or a rev eye, where we're just working on that thin skin around the eye to tighten it. And again, if you want to have surgery and an eyelid surgery, the only other non-surgical way to get on top of the eye and really try and tighten is with this machine. And we can actually go in the eye, just like we can go in the mouth, we can go in the eye for eye bags. So I say with men, there's always a hair, eye, and performance. But eyes, and if you have any kind of bag or heaviness under, this is one of those treatments that we can actually get into the eye and get at the eye bag to reduce that. It's the only non-surgical way to do that. Just like we're tightening skin with tight sculpting, we can also go into the back of the throat for snoring. And we do plan on doing a live for that because snoring, and I shouldn't say snoring, it's sleep apnea. Not all snoring is sleep apnea. And not all sleep apnea has snoring, but sleep apnea can lead to many medical problems. And so if you do have it, you want to treat it. And usually it's a big face mask that you're sleeping with, and they do have a surgery. But you can do this and potentially treat and completely treat sleep apnea. And if you have sleep apnea, and usually a significant other might tell you you stop breathing when you're sleeping, and they're not usually wrong about that. And so if you have sleep apnea, you definitely want to have it treated because it leads to many medical issues and also an increased all-cause mortality. So that's another area that we can tighten in the back of the throat. You can just do skin resurfacing. You can come in, we can also do necks and chests, we can do hands. So you can do resurfacing just about anywhere with that final step of the 4D. So you can do acne scars, you can do any kind of resurfacing, but also women with hands, neck, and chest. So when I say men, it is hair, eyes usually in performance. Not that performance doesn't matter for women, because it does as well. But usually women, we're looking at ourselves in the mirror and we're seeing skin changes, but neck and chest bother us. And we can completely resurface the neck and stimulate collagen elastin with this laser. And so lasers is the real way to get neck skin to actually look more youthful. But the hands are also another area that ages with women with time. And so that's another one that we can resurface with. And we can also add some filler to the hands. It makes a big difference for women. So we can keep our hands looking just like our face and our neck and our chest. So with this treatment, and again, some of the questions, and again, leave questions, send us some comments once you watch the videos and you see, because this isn't painful and it's very comfortable, and you'll see that on the videos. And we have lots of videos on our website and on the YouTube channel that also involve aesthetics. And so the 4D is one of them, and you can see the whole entire treatment. But basically, you usually need at least 3 to start. And again, we have a lot of people that will travel in. So we might do 4D and combine it with a PRF radius and get amazing results. And in fact, and I'll go back to before and afters, but let me just pull this one up. We combined this with this woman, beautiful woman. We combined her treatments of the 4D with PRF radius. And again, just look at smile lines, because you're plumping and stimulating collagen and elastin in multiple different ways. So you can fill out the temples with that and look at the difference. And then smile lines and pigment and just the health of the skin overall. It's just a volume increase with treatment. And usually we'll recommend a series of 3 though, unless if somebody's coming in, and we'll try and combine it with something else to get the most from an in-office visit. And so basically in cost. So when we're looking at cost for a 4D, typically you're right around $3,000 for a series of 3. And it depends on where you're being treated in the country. It might vary a little bit, but that is our price right now. We always recommend a series of 3 to start. And then once we get you to where you want, we can change to a maintenance treatment. And so then we'll discuss, like usually we'll do that series, we will reassess, and we'll see what else is needed with the skin at that point. So do we have some volume we still want to treat? Is it the 4D that we want to use, or do we want to resurface? Do we want to hit pigment? Because we have lots of different lasers. So we might do something that hits the pigment and the redness and use one of our electronic lasers, or we may end up using an IPL that hits pigment. So it just depends what we're doing, or could it be microneedling? And then we have another question about how does the 4D compare to Morpheus 8? And so if anyone is familiar with Morpheus 8, so that's a radiofrequency microneedling. So there's lots of different names for that, but the technology is radiofrequency microneedling. So you will have many different treatment brand name machines, but the underlying technology is pretty basically the same with some differences here and there. But with radiofrequency microneedling, if you know what microneedling is, you're putting needles into the skin and that's stimulating collagen elastin. You're creating microchannels that stimulate collagen elastin. And with a radiofrequency microneedling, you're just driving energy deeper into the skin. So it's like microneedling on steroids is what I say. So microneedling with radiofrequency is a great treatment, but you have to be in the right hands for that, because some protocols are very aggressive. And if it's aggressive and you don't have fat to lose, even though they say you won't have fat loss, there's a potential that you could have fat loss if somebody has no fat loss needed. And so we've seen that happen. So you just have to be in the right hands to be able to have a treatment that isn't going to result in fat loss. So typically what we do, if somebody over 40 wants a lift of any sort and definitely over 50, then we are going to recommend the 4D. That's our go-to for a more intense laser treatment. So not just a maintenance where you're stimulating collagen elastin, you're 30 and you just want to stimulate, or not somebody that's been through a full series and is doing a maintenance either at the same time or after. But our go-to for somebody that wants some tightening and lifting after 40, definitely after 50, is a 4D, unless we have some debulking. So we have a jawline that is not well defined. We have some thickness in here and thickness overall that maybe they're not happy with. Then we want to use the Morpheus 8 potentially to resurface, stimulate collagen and elastin, get some tightening and lifting, and also maybe debulk a little bit, if that makes sense. So our go-to is 4D, unless if we really have some thickness that somebody is looking to see or to make go away. And you never want to use that in an area that doesn't have much in the way of fat, which is the neck and the chest. So there's lots of things that we can resurface with in the neck, which is another question that shouldn't really, our go-to would not be Morpheus for that. Again, unless if you have some submental stuff we want to thicken up and debulk. That's when we would use a radiofrequency microneedling, but it still has got to be customized to the patient so that the patient is not getting any adverse effects when it comes to fat. So just going to a place that has good reviews, that you have trusted providers. We're medical based, so we do a lot of wellness, sexual wellness aesthetics is part of our comprehensive offering, and we have a very strong aesthetic offering. But everyone that treats, all the laser experts, all the laser specialists are, and all of our aesthetic providers are extremely experienced and trained the same way. And so we're going to customize it to you to get the results that you want. And on the neck, we're really looking at, that's an area, neck and chest, that will age people. So we want to stimulate collagen elastin, so lasers. So we will use that resurfacing laser. We'll use a 4D on the neck because you're stimulating collagen elastin in all the areas, but we're not killing any fat. Or you can just resurface if that's needed. We have lots of other different lasers that will lift redness and pigment, because that's another thing that needs to be addressed in the neck is redness and pigment. And we will combine it with PRF radius, because you can't put filler in the neck and the chest. It would look abnormal, but you can put a biostimulatory filler in, and we'll combine that biostimulatory filler with PRF. One of our favorite treatments is combining radius, which is a biostimulatory filler. So it's stimulating collagen elastin, and then you're combining it with PRF, which is a blood product that has growth factors in it. And so that combination works really well with our lasers to stimulate collagen elastin, and it's a stimulation on steroids when you're doing a laser and you're doing an injectable combination. And so that will get you the results that you're looking for, and we'll reassess. Once we've had the initial treatment plan, we're going to reassess, see where you are, but always combine some medical grade skincare with your treatments. It matters. And so those would be something such as Skin Medica, SkinCeuticals, but my favorite is Zeo. And so I love Zeo products, but that's because I've been using them for 7 years. And so I just think no matter what skincare line you go with, because Skin Medica and SkinCeutical are amazing companies, and a lot of our providers prefer one or the other of those, but you do need medical grade. And Ulta MD for a sunscreen is absolutely our favorite. So let us know if you have any questions. Again, 4D in-office procedure, no pain, no downtime, men and women all year round. And it is thickening the entire skin surface. And it's one of the laser treatments where you can go in the mouth to get the deep dermis, so you get results. And then you come to the outer for a mid, and then the third step is actually the upper dermis, and then the resurfacing in the epidermis is the fourth step. And then combining those with others if you need it. So it's always based on the results that you're looking for. That's what we want to get you, is the results that you want to see when you look in the mirror. So let us know your comments. Let us know what you want to hear more about. And I'm willing to deep dive into anything that you want to talk about, aesthetics, wellness, or sexual wellness. So I hope everyone has a great night. If you have any more questions, then just send us comments, and we are going to put the links up for the video on YouTube for the 4D, and the website has the video as well if you're not on YouTube on a regular basis. So you guys have a great evening, and also follow us on social media. We'll see you.